Thank you, Evelyn, for inviting Dr. Hardy and I here today to present palliative care to everyone. And thank you all for attending this presentation. Just to give you a little bit about background of who I am, my name is Ashley Weinmann. I am a nurse practitioner with the Palliative Care Group. And I've been a nurse practitioner for almost about 8 years, and I am board certified as a family nurse practitioner, an acute care, gero practitioner, and palliative and hospice care as well. So I am very fortunate to be able to work with MD Anderson patients. So I hope that we're able to introduce palliative care today. And also we're going to talk a little bit about medicinal marijuana as well, because I know that's something that is fairly new for the state of New Jersey. So we have a lot to go over, and Dr. Hardy will be joining us shortly. Okay. So today we're going to talk about a few things, but it's more of an introduction of palliative care. And as we have subsequent presentations, we're going to go a little bit more in depth and hoping that that helps you out as well. So the discussion topics today is we're going to talk about what is palliative care, the elements of the supportive care of palliative care. I'm going to give you a high level view of advanced care planning and just an overview of that. And then we're going to spend a good amount of time just talking about medical cannabis, which is also known as medicinal marijuana. So what is palliative care? What's interesting is that many people just within the United States really unsure of what palliative care is. So just beforehand, just to let you know, it really grew out of a hospice movement in the United Kingdom in the 1960s. And it actually grew out of a hospice. And then in 2005, a case was presented that palliative care needs to become a subspecialty in medicine. And in 2006, Medicare made it official. So they recognized it as a medical specialty. So it's fairly new if you think about medicine as a whole. So what palliative care is a lot of times it's a holistic approach, also utilizing complementary therapy if we can, to help ease the suffering of cancer patients and cancer survivors. What's most important is that it's not just for patients that have untreatable cancer or terminal cancer. Palliative care can help the day that you receive a diagnosis that could be life-threatening or changing your life. The goal for that is for us to be able to decrease the level of symptoms that could be caused either by cancer or maybe the treatment of the cancer that you're receiving. And this can occur from the moment you're diagnosed, and we can be part of your care for the rest of your life. So it's a little bit different. Sometimes people feel that palliative care is hospice care, and it's not. So I'm hoping that we can give you some education and also to let you know what type of support that we can also offer. So the elements of palliative care. Palliative care is also known as supportive care for symptom control. We are made of an interdisciplinary team to make sure that we're meeting the patient's needs as a whole. It composes of social work, which many of you have already met with the social workers here at MD Anderson, nutrition, pastoral care to give spiritual support, nurses and providers like myself and Dr. Hardy. At many times we're managing pain, fatigue, nausea, loss of appetite, and any other related symptoms. We also assist with advanced care planning. We also talk about end of life. And when needed, we talk about hospice care as well. What our goal is to make sure that we're supporting the patient every step of the way and meeting where their needs are at. So just as an idea of some of the symptom management areas that we focus on in palliative care, and also your oncologist also focuses on this as well. We help with pain, fatigue, nausea. We assist with constipation and diarrhea, depending upon the treatment. Difficulty breathing, where you just feel short of breath. Loss of appetite and a weight loss. Weakness. Sleeping problems, whether it's hard for you to fall asleep or it's hard for you to stay asleep. Sometimes confusion, where maybe the mental status has changed a little bit. We're there to try to determine what we can do to lower the symptom burden so that you have a good quality of life as you go through this journey. Advanced care planning. This is something we spend a large amount of our time doing to help out patients as well as the symptom management. A lot of times, not only can patients, families, providers be a little reluctant to talk about advanced care planning. What we want to be able to do is make sure that it's an ongoing process. We talk about your goals, your values, your wishes in terms of your health care. Because what's important to you today might not be what's important to you in another year or another year from there. We also recommend making sure you're talking to your loved ones. Who are the people in your family that are supportive that might have to make decisions for you if for one reason or another you're unable to? It also allows your doctor, your nurse practitioner, your healthcare team to know what's most important to you as you go through changes with treatment, or that you no longer need treatment and you are now more on the maintenance. It's important so that we know what's the most important. Each patient has a different indicator of what's important to them, and we need to make sure we individualize it, because it's very important for us to make sure if we don't individualize it, then we're not meeting anyone's goals. We also want to talk about what your future might look like and try to also normalize these conversations, because unfortunately as human beings we are not immortal, um, but at the same time we want to have as much control in making sure that we know what our wishes are as human beings. And it also allows your family members and your caregivers to also know uh, how they have to support you as well. And we also talk about that these conversations should happen early on in life, even before a diagnosis. It's important to know and be able to talk about it and to try to normalize it, because it is part of our life. But for many people, it's really difficult to do so, for either whether or not you want to make sure that you're protecting your loved ones, or if you feel that if you talk about it, things might happen. Um, we're there to help with that. We're there to support that. And in our next session in August, we're going to go in a lot more detail where, we recommend you having your caregivers with you if you want, just so that they can hear some of the things that we talk about in a general aspect, and then how we can help as well. And then we also talk about end of life. And this is where the focus shifts to providing end of life care. This could be driven from a patient. It can be a discussion with your oncologist. But what we want to be able to do is not stop your medical plan, but change the shift of it and revise what that plan looks like so that we're there every step of the way to support you. We talk about making sure that you're comfortable and what does that mean to you. We talk about advanced care planning because again, we start from the day that we meet you to the day that we need to, transition to more comfort. And then deciding where and how care will be provided, because that is an individual goal. Some people want to be cared for in their home. Some may not prefer that. There may be certain rituals. It's important to always know what's most important, because that really drives all of our plans, to help with patients, making sure they meet their goals. And then we do talk about hospice care when maybe it's time for hospice care. And that's a conversation, of making sure that maybe this is where you need for the additional support that you need. Um, but that's just part of what palliative care is. We wanted to kind of go through just the high level elements of palliative care, because sometimes palliative care is associated with just hospice, and we do so much more, to help care for a patient their entire life. At this time, again, we wanted to just talk about an overview of palliative care, which we would love to go into a lot more detail in the future, and we can also answer questions at the end of the session. But we wanted to be able to also talk about medical cannabis, which we also know as medical marijuana, And this is where I'd like to hand it over to my colleague, Dr. Sam Hardy, who is our medical director for our palliative care department.
Hey, Ashley, how's it going?
Good. Thank you so much for
Good.
joining us, and we appreciate your time.
Yeah. All right. Hey, everybody. Thanks for joining us. So I'm Sam Hardy. Before I talk too much, Ash, can you hear me all right?
Yes, we can hear you really well.
iPhone. Okay, great. All right. So I'm Sam Hardy. I'm one of the palliative care docs here. I'm going to talk just a little bit about medical marijuana. But as far as what I do here at at MD Anderson, so I'm an internist, and I have specialty training helping to take care of cancer patients that I actually got here. And my role and our team's role, we've talked about a bit, but one of the major roles that we play is to help people who have cancer with pain or other symptoms, whether those are being caused by the cancer or by treatment that they're getting. So oncologists focus on dealing with cancer, and we focus on trying to help people feel better while they're dealing with that. Over the past 6 years that I participated in the New Jersey medical marijuana program, I've personally certified over 1,200 patients for the program. So we have quite a bit of experience with it in my clinic. And if we can advance to the next slide, we'll talk more about this. So medical cannabis and adult use or recreational cannabis. So what's the difference? Well, there are a couple things in the state of New Jersey. Number one, I think most people know at this point that medical marijuana, or not medical marijuana, recreational marijuana, that it's supposed to be legal in New Jersey. I'll say that the recreational program, or we're calling it adult use here, is not really ready for prime time. So, things are not at a point where people can just walk into a medical marijuana dispensary or walk into I'm going to keep saying medical marijuana because those two words are just tied together in my vocabulary now, so I apologize. You can't just walk into a marijuana dispensary at this point and buy marijuana, whether it's for recreational purposes or for medical purposes. In order to actually get marijuana in the state of New Jersey, you have to have a medical marijuana card. So those medical marijuana cards are only good in whatever state you have that in. So the federal government has decided that they are taking a hands-off approach to how individual states want to regulate the use of cannabis. And so states that want to allow their citizens to have access to a medical marijuana program can go ahead and do that without interference from the federal government. And states that want to have that want people to be able to get marijuana to use recreationally, they've taken a hands-off approach to that as well. So in New Jersey, right now, like I said, you have to have a card to be able to get marijuana, but you can't take that card over, say, to Pennsylvania, where they also have a medical marijuana program, and use that card in Pennsylvania. They don't transfer from one state to another. At the bottom line, you have to have, in order to be able to get a medical marijuana card in New Jersey, you have to have what they call a qualifying medical condition. In the legal term that they often use is a debilitating medical condition. I'm not sure that I really like the word debilitating, but it's New Jersey and it's a law, so we don't necessarily always like it. Can we go to the next slide? Super. So what is it? I mean, it's a plant. It's been around for a really long time. People have been using cannabis for thousands of years at this point. Excuse me. Sorry about that. There was somebody at the door. In any case, so it's a plant. People have been using it for thousands of years, and this is what you actually get when you go to a marijuana dispensary in the state of New Jersey. Cannabinoids, that's the scientific name for the active ingredients. And there are a couple that are listed on this slide, THC and CBD, which a lot of people have heard of. And then there is also, we should mention there is also a pill that you can get a prescription for that is different from medical marijuana. And the generic name for it is dronabinol. Some people know it as Marinol. And that pill is approved by the FDA to treat certain conditions. It's worth noting that marijuana itself is not approved by the FDA for anything. And it's actually considered still as what they call a Schedule I drug, which means that the federal government and federal law considers marijuana to be as dangerous as heroin or PCP, which I think is absolutely ridiculous, and has also made it difficult to study marijuana and a lot of its clinical benefits. But let's move on to the next slide. Okay, so how can marijuana affect symptoms of cancer? So like I said, I have a lot of patients that use medical marijuana, and I've certified over 1,200 people for the program. And the experience that our patients have had and what they tell us is that it helps with a lot of the symptoms that people with cancer deal with. It can help with pain. It can help with nausea. It can help with appetite. It can help with difficulty sleeping. It can help with anxiety. And pretty much everybody that we're taking care of has at least one or two of those problems, and a lot of people have all five. So it's nice because it's one thing, it's one medication that can treat a lot of different problems, and compared to a lot of other things that people are putting into their bodies, medication specifically, it's relatively safe. So, for example, in thousands of years that people have been using cannabis, and it has been thousands of years, we don't know of anybody in that entire time that's ever overdosed and died from using too much marijuana. And if you think about it real hard, I bet you cannot think of a single person that's happened to. And if you know of somebody that's happened to, please let me know, and we will write a scientific paper about it together, and we'll get published and be famous. So you cannot say that. You cannot say that about so many other medications. You definitely can't say that about narcotic pain medications. You can't say that about most sleep medications. You can't say that about Tylenol. You can't even say that about a lot of vitamins. So because it takes care of so many symptoms, and because it can allow people to take less of the other medications which can be more dangerous, I like the safety profile of marijuana. This slide just shows these are the forms that people can use cannabis in New Jersey through the New Jersey Medical Marijuana Program. Most of our patients do not smoke it. Most of the folks that we take care of either use things like lozenges that they can suck on, or oils that they can put in their mouth. Some people will use it topically. They make topical products. For example, we take care of many patients with breast cancer who have had a mastectomy, and they have scar tissue that's painful. So they'll use some topical cannabis on that. Or people with very bad neuropathy, sometimes they'll put it on their feet or use it on their hands. They make vaporizer cartridges that you can get at the dispensaries, and then there's smoking, but yeah, I don't in general recommend that people smoke it. Next slide, please. Okay, so who can actually get medical cannabis in New Jersey? All right, so there's the word debilitating, right? And again, that's the language that the New Jersey legislature, in all of their tremendous wisdom, chose to talk about what qualifies you for medical cannabis. So this is an alphabetical list. I'll point out a couple of them here. The second one in the first row, anxiety. So if you have anxiety, especially if you have severe anxiety, you qualify for medical marijuana. So I suspect that a lot of people that you know, whether regardless of any other health problems they might have, would actually qualify for medical marijuana. Just having cancer, the next one over, just having cancer automatically qualifies somebody for the medical marijuana program. Any kind of chronic pain, so if somebody had a car accident in 1992 and they had whiplash, and ever since then their neck hurts, that's something that qualifies you for medical marijuana. Just to pick out a couple other here, irritable bowel syndrome and Crohn's disease, muscular dystrophy, migraine headaches, addiction to opioids, and of course seizures, and then anyone who has any disease, regardless of what the disease is, if they have a year or less life expectancy, then they also qualify for the medical marijuana program. The majority of folks that I certify in my clinic are being certified for cancer, and or anxiety, and chronic pain. So next slide. Okay. So then what do you do if you want to, if you want to sign up for the medical marijuana program? So the way it works is that you have to meet with a physician, and at this point, they are only allowing physicians to certify people for the medical marijuana program. At some point in the future, and we periodically call the state to ask them, so when is this happening? And they haven't told us, but at some point in the future, nurse practitioners will also be able to to certify people for the medical marijuana program. But as of now, it is only physicians. So one of the rules is that you have to have a bona fide relationship with a physician who's registered with the program. Basically, the way that they establish bona fide relationship is either three office visits, or an office visit that includes, a review of history, a physical exam, and the point of the bona fide, doctor-patient relationship is that they didn't want the kind of thing that happened in California, where basically they set up a lemonade stand across from the marijuana dispensary with a doc who you'd walk up and say I stubbed my toe, and they say, okay, well, use marijuana for that, and you go. It was kind of a joke, it was actually a recreational program. So they didn't want that in New Jersey. Whether you agree with that or not, that's how they did it. You do have to be a resident of the state of New Jersey. So, I mentioned before that the medical marijuana, or any marijuana program, is a state-by-state thing. So to be in the New Jersey medical marijuana program, you have to live in the state of New Jersey. You have to have either a New Jersey driver's license or be registered to vote in the state of New Jersey. And you have to have one of the qualifying conditions that was on the previous slide. So, bona fide relationship with a physician. You have to live in New Jersey, and you have to have one of the conditions that qualifies. Next slide, yeah. So what kind of cannabis should I use? So there's no like one size fits all for everybody with marijuana. There are a lot of different strains and different potencies and different dosage forms, and those are also changing all the time. So there is some trial and error that's involved with medical marijuana, much more so than most other medications. Remember though that remember that we were saying a few minutes ago that people don't overdose and die from using too much marijuana. So what I tell people, it's okay to try things out. It's okay to try using a little bit more. It's okay to try a different strain. You don't have to worry that you're going to do yourself irreversible harm if you accidentally use more than you meant to. I will say that if somebody uses too much marijuana, you may feel sick and you may fall asleep, but you are going to wake up again. At the medical marijuana dispensaries in New Jersey, the first time that you go there, you always have a consultation with one of the folks that works at the dispensary to talk about what your symptoms are and the different types of marijuana that they have at that dispensary and the different ways that you can use it. So they help you to figure out, which strain or strains are going to work best for the problem or problems that you're hoping to address with the marijuana. Next slide, please. Okay. So here are some things that, or here's kind of a checklist for becoming a qualified patient. So you do want to talk with your oncologist about whether or not this is something that they think could help you. You need to then you need to find a physician who participates in the program, and there's the website that you go to. It's all online. This information is available online, includes the contact information for the folks that participate in the program, not for the patients, for the physicians that participate. Schedule an appointment for certification. Follow the instructions that you get from the doc that certifies you. Now, here's an important point. From the time that you give the state of New Jersey everything that they ask for, because they want to make sure that you're a real person, that you live in the state of New Jersey, and that you're not a drug dealer. From the time that you give them everything until you actually get a medical marijuana card in the mail, which is the thing that's going to allow you to be able to get medical marijuana from a dispensary, that time is going to be anywhere from 2 to 4 weeks. And we don't have any control over that. So that's just something to keep in mind. There's always a lag time between when you see the doctor and get the paperwork that you need, when you sign up online and give them everything that the state asks for, and then when you actually have the medical marijuana card. Once you get that card in the mail, then you contact your medical marijuana dispensary, also known as an alternative treatment center, to make your initial appointment for intake. Next slide. Okay.
I think, Sam, that's where we can open this up to questions.
Yeah.
Evelyn?
Yeah, sure.
Yes, absolutely. If anyone, first of all, thanks for that great talk. I think that definitely both palliative care and what it entails and medical marijuana are sometimes like these little known entities where we've heard of it, we've heard the buzz, but sometimes we don't know about it as much as we would like to. So we want to open now the talk to questions and answers. You can unmute yourself if you'd like to ask any questions you like, or you can also put in a question in the chat box, whatever you'd like to do. Does anyone want to start us?
Yes, I have a question. I've noticed Amazon sells CBD, but I was concerned about the quality of it, or if there's any concern about getting it online like that.
Yeah, thank you for that question. That's a really good question. I'm getting a little bit of feedback. Would you mind just muting yourself while I'm talking for a minute? Okay. All right, great. That's better. So that's a great question, and people ask me that a lot when they come to talk about medical marijuana. So there is definitely a difference between medical marijuana and what you get at a medical marijuana dispensary versus CBD oil that you can get various places. You can find it online from specialty stores. You can get it. I think they may have like a kiosk at the Cherry Hill Mall. There's certainly lots of storefronts around. You can go on Amazon. So lots of people are selling CBD oil, and here's what I say about that. It's considered a dietary supplement by the Food and Drug Administration. Okay, so what? That means that it's not as closely monitored and regulated as it would be if the FDA considered it a medication. The bottom line is that when you buy CBD oil, whether it's from a storefront or wherever, what you're getting is probably CBD oil, and what you're getting is probably what it says on the label, but it might not be. And there have been a number of exposés in the last several years where, like a local TV station goes and buys a bunch of CBD oil, and they send it to the local university science lab, and they test it, and they find out no, it's not as it's actually not as strong as it says it is, or it's not just CBD oil, it's got something else in it too, or it's not CBD oil at all. In contrast to that, right? So the FDA is considering it a supplement, and they're not really regulating it very heavily. In contrast to that, everything that gets sold at a medical marijuana dispensary is very, very strictly regulated by the state of New Jersey. So everything that gets sold at a at a medical marijuana dispensary is subject to random testing and very sophisticated chemical testing done at state labs. And then the results of that testing get published online. So anybody can go and look and see, you know, so what's actually in the product that I got at the medical marijuana dispensary. This means that the medical marijuana dispensary has no incentive to give you anything other than what they say that they're giving you, because if they were doing that, they'd get shut down and probably prosecuted. So, you know, as far as knowing what you're getting, you know what you're getting when you get something at a medical marijuana dispensary. You don't know quite as, you know, with quite as much confidence that when you buy CBD at the store, that it's necessarily what it says on the bottle. And then with all of that said, marijuana dispensaries tend to focus on products that are, they tend to emphasize THC over CBD. And I have had some patients who've told me that that when they went to the medical marijuana dispensary, they just didn't see what they were looking for as far as CBD. So they ended up getting it elsewhere. I hope that answers your question.
I have one other question about that.
Mm-hmm.
Has your experience been people getting it online have had success, or not that much?
You know, I'll say I can't say how much success. I can tell you that I've had a couple of people who were unhappy about stuff that they got on. I'll just say that, you know, that they got on Amazon specifically. But nobody has told me that there was, you know, some specific thing that they got online that they thought was fantastic.
Okay, thank you.
You're welcome. Thank you for your question. What else can we try and answer for you right now?
Can I ask a question? I'm wondering, is this more tailored to the pain, manage the pain, or it will going to customize to your symptom? Or everybody in pain just get the same kind of whatever dispenser?
Yeah. No, I think so. Just to make sure that I'm understanding correctly, I think you're asking, are there different types of marijuana for for different types of pain? Is that what you're asking?
Yeah.
Okay. You know, that's a difficult question to answer. I'm sorry. I think that the THC predominant strains tend to be more helpful for pain in general than the CBD predominant strains. But there isn't like one strain that's going to help, you know, neuropathy, and one strain that is going to help, you know, chronic low back pain, or, you know, one strain that's going to help, you know, pain from pancreas cancer. It's going to be the strains that are THC predominant that help pain in general, but they aren't targeted to a specific type of pain. Did that answer your question?
It does.
Okay. Good. Thank you for your question.
And this is Ashley. I think too, when we talked about like one size doesn't fit all, and that sometimes it's a little bit by trial by error of trying one strain or one dosage and seeing if that helps out that particular pain, and then making modifications just as if we would make modifications to medication that we prescribe for a particular symptom.
Yeah, and sometimes, yeah, so, sometimes people will, they'll go to the dispensary and, they'll get a particular strain for their nausea, say, and they find it really helpful. And, another patient will try that same strain for nausea and they don't find it as helpful. But then when they try a different strain, that one does help them. So yeah, it isn't always that that exactly the same strains will help everybody with the same symptom. I hope that made sense. It made sense in my head. Did it make sense when I said it? I hope so.
Okay. It is helpful.
Okay.
It is
All right.
imagine at this point, and just how it looks like. But I get the sense that it is possible to adjust if whatever the first dose you got won't work, or you can't go back always say, can you try something?
That's correct.
Yeah, got you.
That's correct. Right. So it, if somebody tries it and the first thing that they try they don't find as helpful as they wish that it was, yes, they can go, and there are other things that they'll be able to try, because everybody is going to be a little bit different as far as which type of marijuana their body is going to respond best to. What other questions can we answer?
Hi, I'd like to ask a question.
Mm-hmm. Yes.
Are they opening more of the dispensaries in New Jersey? I was approved for medical marijuana a couple of years ago.
Yeah.
One way down, like each one was like an hour away.
Yeah.
I think there's
So
one in like Sewell or down that way.
Yeah, they are opening more medical marijuana dispensaries, and like everything in New Jersey, and to be clear, I've been in Jersey my whole life, so I'm speaking as somebody who knows from experience, right?
Gotcha.
I think we know what New Jersey is like, and so they've been planning for a very long time to open many dispensaries, and they've opened a couple more. In South Jersey, the main ones are in. There's one in Atlantic City. There's one in Egg Harbor,
Right.
and there's the one in Belmar by Deptford. So the medical marijuana website, the state website, has a list of all of the dispensaries in the state. They have some more up north. I'm not as familiar with those because most of the folks we take care of are in South Jersey.
Right.
But I would say keep an eye on the list on the website.
Okay. Now, is it?
And they just opened one in Edgewater Park. Anne Marie is saying, so that's good. Okay.
And is it still a few $100s for like
Yeah.
the consultation and $200 for the card itself?
Yeah. So so thank you for bringing that up. And that's an important point. So all of the cost for medical marijuana, unfortunately, is out of pocket.
Right.
Because, I mentioned it a couple of times, because marijuana is still considered a Schedule I drug by the federal government, insurance companies do not cover medical marijuana. They cover none of the cost of medical marijuana. Moreover, marijuana has to be purchased in cash because banks are federally regulated institutions, and so they cannot participate in the marijuana trade. The cost for a medical marijuana card in New Jersey is $100. That you do pay with a credit card because that goes directly to the state of New Jersey, and that's just to cover administrative costs for their program. So it's $100 that you have to pay every 2 years. For some people, the cost will be reduced to $20. So things that will qualify you for the $20 card fee will be if you're 65 or older, if you have Medicaid, if you have Social Security, disability, and a couple other government assistance programs. It used to be $200. The card used to cost $200, but they did reduce the price to $100. I still think that that's more than they should be charging for it, but that is what it is. As far as the cost of the marijuana itself, it's different for everybody. It depends on what people are getting and how much they're getting of it, but it can get quite expensive. People can spend a couple few $100s a month. Again, depending on what they're getting and how much they're using. But the out of pocket cost can get high, and it can get high quickly, unfortunately.
Yeah.
Thank you for yeah. Mm-hmm.
Oh, I'm sorry, Sam. I also wanted to let you know, I just read on the newjersey.gov to answer Kim's question too. It stated that the Department of Health is currently seeking new applicants to operate up to another 24 additional alternative treatment centers, 8 of which will be in the northern region of the state, 8 in the central, and 7 in South Jersey.
Oh, that's great.
So you can also look online at newjersey.gov with the medicinal marijuana, and they're very transparent with that information so that you can stay up to date on what's actually happening.
Great, thank you.
You're welcome.
Dr. Hardy, quick question.
Mm-hmm. Yes.
You mentioned that you have to be affiliated with a registered physician, and is there a certain number of times you have to see that provider? And if so, is that a specific medical marijuana provider you have to see, or can it be other providers within the same practice, say like MD Anderson?
Yeah, that's a great question. The way that I do it is that the first time that I see somebody, I do a thorough review of their medical record and take a history and physical when I see them and discuss medical marijuana in detail and establish a bona fide and plan follow up and establish a bona fide doctor-patient relationship that way. The other way that you can establish that relationship is to have 3 visits with a physician, and I think that an unfortunate byproduct of the medical marijuana program and the way that they set up the law was that it created kind of a cottage industry where physicians can charge people a bunch of money that they have to pay out of pocket to have 3 visits with them, and then they'll certify them for medical marijuana for a few months, and then you have to keep coming back. That's not how I do things. That's, you know, and that's primarily because I'm working with cancer patients, and that's just not how I do things. But that, you know, there is a cottage industry out there that you know, that does that. Can you transfer it to other you know, to other physicians? So if, say, for example, if you know, somebody has a medical marijuana card, and this actually happens a lot. Say somebody comes to me for their first appointment with me, and they have a medical marijuana card already that they've gotten, you know, elsewhere. I am able to transfer them to, you know, like bring them under my name in the medical marijuana program and take over the certification. So just because one physician, you know, one particular physician gave you a medical marijuana card, that doesn't mean that you then can only ever see that physician for medical marijuana in the future. You can transfer your care to a different physician, and hopefully in the future to a different nurse practitioner, you know, who can then take that over and be in charge of your medical marijuana. Did that answer your question?
Yeah, partially. The one other question I have is, like, say someone was to see you and get certified, and they needed to have like another visit or 2 visits in a year or 2 years or whatever it is. If they have an appointment, say with Dr. Maida or with Dr. Grana, because you're under that same umbrella, does that count, or does it specifically have to be an appointment with you?
I got you. Yeah. So it does specifically have to be with whatever physician certified you for the program. So you know, if it's somebody that I gave the certification to, then that person would need to see me, unless they wanted to transfer their certification to another physician who also participated in the program. So if Dr. Grana was participating in the program and you talked to her about transferring the card over to her, then you could just see her. But specifically, she would have to take over the certification.
Understood. Thank you.
Yeah, you're welcome. Absolutely. Thank you for your question.
Hi, I have a question.
Yes.
So earlier you mentioned dronabinol, the pharmaceutical form of THC. Is that something that is prescribed and taken to a local pharmacy, or I haven't seen that at a dispensary?
It is, yeah. It's actually it is an FDA approved pharmaceutical pill that you get at a regular pharmacy. So they do not have that at a medical marijuana dispensary. So what's the difference between dronabinol and medical marijuana, or what are the differences, aside from the fact that, you know, one is a pill that you get at a pharmacy and the other is plant-based product that you get at a dispensary? So dronabinol is a synthetic form of THC. So remember earlier we talked about there are two major types of cannabinoids, right? There are 2 major types of active ingredient in marijuana. One is THC, the other is CBD. So dronabinol is THC that's made in a laboratory and then put into a pill for people to take. The FDA has approved dronabinol for just a couple of things. It's approved for nausea and vomiting that is caused by chemotherapy, and it's approved for appetite stimulation for people who have HIV/AIDS. Those are the only things that it's approved for. It's not approved for appetite stimulation in cancer patients. It's not approved for pain. It's not approved for anxiety. It's not approved for insomnia. And in my experience, it's not very helpful. Dronabinol isn't very helpful with those things.
Okay.
So why is it that medical marijuana may help with all these other problems and dronabinol doesn't? I think it's because medical marijuana, when you get it, you're not just getting this one THC molecule, right? You're not just getting this one thing. You're getting dozens of cannabinoids. You're getting the CBD also. You're getting different forms of THC rather than just this one thing that was synthesized in a laboratory. So I think you're getting your body is seeing more a greater variety of the active ingredients when you're using medical marijuana as opposed to when you take a prescription dronabinol.
Okay. All right. Thank you. That's interesting.
Yeah, you're welcome. Thank you for your question.